spoke.
Be all on the same page.
We spoke to Paul yesterday. He didn't. The lecture didn't come through. We had a very interesting half hour, and he says he works directly with endocrinologists right across the street with a large group. So my question to you is, how much do the primary care and internal medicine people and the endocrinologists know about this advanced technology that Conan has, that they're sponsoring here? But this we don't have to worry about COPE. We can talk about these things here. So do you spend any missionary time speaking to MDs about this?
And that's an excellent question, Paul. And right now the answer is no. I had a terrible experience when I acquired the lens fluorescence biomicroscope, that instrument that was made by ClearPath. That thing was really cool, where you were looking for these glycosylated end products, these AGEs in the lens. And so I bought the machine. It was real slick. I'm trying to identify people that have diabetes that didn't know they were diabetic. And I started picking people up. We would send, notes to the family practice guys or the endocrinologist. And not really endocrinologists, almost by definition, these people are treating diabetics. It would usually be family practice guys or internists, and they'd be working on high blood pressure or cholesterol. And I'd send a note, hey, I think this guy might be diabetic. Would you please check his glucose, check all this stuff? And I'd get these nasty, hey, don't interfere with the practice of medicine. Hey, get away from me. You're just an optometrist.
Wow.
Hey, you don't know what you're talking about. So, I mean, it was almost 90% rejection of me trying to introduce the technology and get the medical doctors to alter their practice patterns. It was very disappointing. And after a while, I gave up because it was creating high drama with the patients, because then I was putting the patient between me and their medical doctor. And as good as I am, and I'm real good, man, they usually choose their medical guys.
Sure.
They usually do. I mean, I got to tell you, they usually choose their medical doctor over their optometrist,
right.
Probably 80% of the time. And so I was swimming upstream with one hand, and I just like, okay, I'm gonna let this fight go. So I actually stopped using the machine and stuck it in my garage, even though it produced clinical benefit, because I just got tired of fighting the medical guys.
Right.
But now on this new stuff that I'm doing with the OCTA, angiography, and the multispectral imaging, I just run a parallel course. I don't mess with them. Right. They're not going to understand. I hate to say it. I hate to be negative, but you guys know how I feel. If I started sending notes to these guys saying, hey, our mutual patient has subclinical diabetic retinopathy that I picked up with this fancy $70,000 OCTA machine, would you please get more aggressive with their treatment? They're going to say, well, let me send that patient to an ophthalmologist to make sure they have diabetic retinopathy. And if that ophthalmologist doesn't have the same technology I've got, or if it's not a retina specialist where they're going to do an intravenous fluorescein angiogram, they're not going to see anything. And so then that second opinion is going to debunk my correct opinion. And again, I've been through it. I started it, 2 or 3 times. Guys started going left on me. I'm like, okay, fine. So I double back and I just run a parallel course. So I tell the patient, hey, I've got more technology than they got in the space shuttle. You can see that for your own eyes. Okay. You with me on that? Yeah, doc, we with you. We know we're in the best place in town. Okay. I'm 5 years ahead of your guy. All right. It's not his fault. It's just the way it is. I'm like that. Okay. That's why you come in here. So I'm 5 years ahead of your guy. We're going to work it like that. I'm going to tell you the truth. I'm going to tell you what's going on. And sometimes your guy might not agree with me because he's going by 22-year-old guidelines or she's going by 22-year-old guidelines. So if I don't see any blood in your eye, I'm going to tell your guy that you're normal. Okay. Because all it's going to do is cause drama. If I see stuff that no one else could see, I'm going to tell you, and we're going to start working on it. Okay. You got me? And everybody buys in because they like me and I'm good at this stuff. So that's an excellent question. And unless the guy is like Paul Chauce's guy, where they're intimate and next door and been working together for 20 years, and all Paul Chauce has to do is say, hey, I've got a guy with subclinical diabetic retinopathy, and the internist that he's working with says, okay, fine, what do you want me to do? I don't have a lot of guys like that around here. And if you don't have one working in your office or next door to you, you're not going to have one either.
Right.
I think you're going to have to do it like I do.
But what about
on nutritional supplements?
Right.
Go ahead.
But what about a functional test, right? Because Conan's tests, these are functional tests, right? You're getting people with decreased contrast sensitivity and so forth. I mean, that's something that, do they reject that too when you show this to them? Like, hey,
they reject it all.
That's crazy.
They go by visual acuity
Wow.
and observable fundus findings. They go by the guidelines from 22 years ago.
Wow.
Period. And until it changes from a medical legal sense, or there's some new study that comes out where it sets the peer-reviewed literature thing on its end, then that's the way these guys are. I don't have the wherewithal to fight them. So again, I just run parallel. And I tell the patient, hey, we're going to run parallel. You don't have to tell them what we're doing. You can if you want to. I don't care. I ain't going to tell them nothing. If I don't see any blood in your eye, I'm going to tell them you're okay. And then we're going to do all this other stuff, all right? If they got 20/20 vision, but I see an abnormal ERG and decreased color vision and reduced retinal sensitivity on the threshold field, and they've still got 20/20 acuity, I'm not telling that guy anything. He's not going to believe me, and he's not going to do anything different. So I'm going to have to do everything different, which I got no problem with.